So today I will be presenting Unit 8, the roles and responsibilities of a registered nurse. This will consist of the transformation of the nursing role and what is a nurse, and the impact and responsibilities, the Nurse and Midwifery Council and the Code, and then to go on to discuss the communication in a multidisciplinary healthcare setting. What is a registered nurse? Nurses are an integral part of the healthcare setting where they collaborate care of all ages, illnesses, from physical to mental health. Registered nurses are responsible for providing high quality care and using their clinical skills and knowledge to treat patients. Evidence-based decisions making, as well as the clinical side of the nursing profession, a nurse needs to have compassion, competence, respect, commitment, and provide exemplary care at all times, and to be a core member of the healthcare setting and an advocate to patients' well-being and needs. We have 4 key areas of nursing. We have adult nursing, children's nursing, mental health nursing, and learning disability nursing. The nursing role has changed significantly since the time the nurse role came into place, approximately 300 AD during the Roman Empire, where the first known documentation speaks of nursing throughout these ages. Nursing became considerably more apparent during the Middle Ages, where advancements and innovation made changes to the development, the base of the modern-day nursing as which we know for today. In 1883, Ethel Bedford Fenwick founded the British Nurse Association with her doctor husband. Her campaign for standardization training for nurses, which then led to develop the Nurse Register, in which Ethel was the first to sign on to this register. In 1904, Ethel founded the National Council for Nurses of Great Britain and Ireland. The training and education of nurses was hospital-based, and that variation of the training for the nurses depended on which hospital they were trained at. In 1860, Florence Nightingale developed her first training school where nurses were at the St Thomas Hospital in London, which was formed for nurses to start their training. There was no registration for nurses until the Nurse Registration Act in 1919 was introduced and led registered nurses to have 3 years training followed by examination. Until the 20th century, nursing had been a vocation rather than a professional. Charlotte Crouch became the first nurse in the world to be awarded a PhD. This was the start and drive for nurses to progress an academic path. The education of nurses moved away from hospital-based learning to university study, develop knowledge and skills to gain a degree in nursing and become a skill-registered healthcare professional. The role of the nurse has predominantly been a female throughout history. However, the rise in male nurses has increased a small amount each year. Society's attitude for the role being a female career has changed. Project 2000 has shown significant changes to the nursing over the years, with higher and continuing education for nurses. The 6 C's of nurses was established by the England Chief Nursing Officer Jane Cunningham: care, compassion, courage, communicate. Following these 6 C's within the nursing role allows the nurse to treat a patient with the best care that can be offered. The changes of the roles and responsibility for a nurse. The role and responsibility for a registered nurse are adapting through time and as part of a multidisciplinary team where their expertise are valued and discussed with other healthcare professionals. Opportunities for new nursing roles has developed from specialised nursing, such as a nurse practitioner, emergency care practitioner, diabetic nurse, clinical care nurse, and many more other roles. Some of these specialised nurses are able to prescribe medication, With the increase of community care and screening programs, there has been a significant advance for nursing for them to utilise their skills and knowledge to educate and empower patients to choose the right decision for their health, treat and care for patients, and discuss a treatment plan with their families. Although these positive changes have seen a rise in further higher education for nurses, there has been many things that have impacted the nursing role, such as the economics, political and social, budget cuts, inflation, and public demand, and the aging population. All registered professional bodies have a code of conduct to follow. Nurses and midwives are regulated by the Nurse and Midwifery Council, and to follow the code, which was founded in 2001. The code is responsible for regulating all nurses and midwives in Wales, Northern Ireland, Scotland, and England. The MNC, the Nurse and Midwifery Council, is to protect the health and well-being of the general public, appoint professional standards of education, conduct and perform nursing. They are also responsible for dealing complaints and concerns and will investigate any allegations made against a nurse, and the secondary legislation was created in the Health Act in 1999. All registered nurses need to be accountable for their actions and work within their scope of practice, following the policies, procedures, and the law. The MMC requires all registered nurses and midwives to renew their registration every 3 years, with evidence of continuing professional development. By undertaking the 35 hours of a relevant scope of practice, within the 35 hours, 20 of these hours must include practicalisation, learning and producing evidence of all continuing professional development. And as well as the 35 hours of the CPD, the continuing professional development, nurses and midwives are required to do further evidence. 5 written reflective accounts of practice, 5 practice-related feedback, reflect discussion with other registered MNC nurses, and a health and character declaration, professional indemnity arrangements, and confirmation. The revalidation of the MNC requires and allows them to monitor good practice, knowledge, and professionalism of all nurses and midwives. If nurses or midwives were not compliable to these standards set by the MMC code, then disciplinary actions could be taken and result in suspension from duty or prosecution from the regulative bodies. The code. The code is centered by 4 principles in which nurses and midwives need to follow. Nurses and midwives need to abide to the code at all times and are governed by the law and ethics. Prioritize patients, practice efficiency, preserve safety and professionalism. They would need to treat patients with dignity, listen, evaluate, and meet patients' needs and patients' rights. To treat patients with efficiency and meet their needs by requirements, have clear and concise documentation on the patient's medical records, and at all times communicate with the patient, their family, and other colleagues. Ensure patient safety, acknowledgement, and working within their limitations, and to report any safety concerns. And lastly, to uphold professionalism and to follow the code throughout their career. Multidisciplinary team. Within the healthcare setting, multidisciplinary teams are utilised to achieve their goal of sharing information from several healthcare professionals such as nurses, doctors, pharmacists and surgeons. They would combine all their expertise to meet the patient's needs and treatment plan in question. Within the MTD meeting, the multidisciplinary team take live minute notes which are taken in real time throughout the meeting. In each meeting, a coordinator should give should be given the charge to make sure the meeting and all the information is done within the designated time frame, and all the members in the room know their duties and responsibilities and take accountability for their actions. Clear outline of what information needs to be shared among the team. Throughout the meeting, communication needs to remain professional when all attendants need to be given an acting, listening, reflecting on issues raised, compromise where opinions may differ, and always allow others to speak freely. Those in attendance must also be mindful of the tone, body language, and facial expressions throughout the meeting. Every professional involved in the MTD has the same goal to achieve by providing the best support for the patient and their family, a treatment plan, a referral to another pathway if needed, and prevent any misunderstanding from different professionals, prevent any errors of vital, clinical, or social information to be missed which could impact on that patient. All communication within the multidisciplinary team allows a smoother transfer for patients' care. The role of the nurse depends on their expertise and experiences, and the nurse includes compassion when dealing with the patient's family when providing their treatment plan or medication, and discussing the pros and cons of the treatment plan which may impact on their lives. Every member of the multidisciplinary team must always follow the law and procedures when regarding information sharing, and to gain consent to liaise and to provide the information to other healthcare professionals within the meeting or further. My conclusion. Within the nursing field being one of the largest groups of the healthcare professionals within the NHS, nurses have to be registered on the RMC register and abide to the code of conduct to provide safe practice. The nurse's role is evolving all the time and bringing new opportunities for nurses. The NMC was established to protect patients and to ensure nurses are competent at their roles, and validation every 3 years allows the nurse to adapt and to be up to date with new changes to the law, policies and procedures. Thank you.